We started our journey some almost now 2 decades ago to try and start moving into the digital world. You have been our partners for a good part of that journey, a journey that has enabled many Kenyans to, through the use of technology, through the use of the digitization program that we have had, to access financial services, to access knowledge, to enhance their business capacities, and for Kenya ultimately to become one of the startup capitals of the African continent. This wouldn't have happened without the partnership of companies like yourself, who have had that faith, that trust, and that confidence in our country and in the potential that exists out there for us to have what I always call a win-win situation. We have seen an exponential growth in terms of the use of, or let's say, of the digital economy in our country. We're not where we want to be. We must ensure that even as we move forward, the backward linkages of making sure that we have our people properly trained, starting at very early ages in school, which is part of the digital program that we have started at a very early age to get our youngest to be able to make technology part and parcel of their life. That is the future. We want them prepared. We want them ready. And we are investing quite heavily in that particular field to prepare them for that digital world, that digital future, which ultimately, I do strongly believe, will be the driving force of the global economy in years to come. And we want to take full advantage of the greatest gift that we have. And that gift that we have, I always tell people, is not gold, it's not diamonds, it's not oil, it's our young people. And we want to really ensure that we have properly skilled them to be able to be the giants of the future. And this we want to do, and we appreciate the very close collaboration that we have with you. It's been very apparent, especially during this unfortunate COVID period, how necessary and indeed how useful technology can be to ensure that the world doesn't come to a stop. I'm telling people that it's one of the most amazing things, despite the achievements that we've been able to achieve in terms of health, in terms of tracking COVID across and contact tracing and everything else. So despite the health side of it, we have also been able to continue, not in the same way, but with education. We've been able to have businesses continue because of connectivity. We've been able to have business and government continue running because of connectivity. One of the things, whenever I'm dealing with my colleagues across the globe, I keep telling them that I've saved considerable amounts of money. A normal summit that we would spend to the tune of tens of thousands of dollars to attend a summit. I'm now doing a summit for less than $300. So it's a wonderful gift that we have, and a wonderful opportunity that we have, that we can expand and grow even further. And I'm really looking forward to partnering with yourself, with your team and others, to see how we can ensure that we upscale and ensure that through the use of the digital economy, the digital world, we can expand our economies, our growth and opportunities for our young people. So I personally am quite excited about our partnership, and I'm looking forward to deepening it. I appreciate the renewed commitment through the promises that you've made, especially, let me say that the one that touches me the most is the support for our SMEs, because as a country we believe that this is where the future lies. We want to really ensure that we leave nobody behind. True growth on the African continent, true growth in Kenya, is going to be driven by SMEs. And we need to be able to tool them to be able to take advantage of that and not to be left behind by the larger entities. And this will also help with the vertical integration of our corporations as well, because if we have that connectivity, you will have the SMEs being able to be suppliers of the bigger boys, and this is something that I am personally very keen on. So that support, all your support is appreciated, but in particular, one area I would really like to see us work a lot more together is in the area of supporting our SMEs and tooling them and equipping them and giving them the necessary support so that even as we move, which I hope corporations like yourself will continue to support us with when we're talking about this move that we are trying to make to create a free trade area between the United States of America and Kenya. This would be a great opening and new opportunities for our SMEs to link up with American counterparts and to take advantage of the almost 1.6 billion Africans across the globe through the Africa Free Trade Arrangement, but also to open up new opportunities for SMEs in Kenya to take advantage of the global markets as well. So I look forward to our continued partnership. I look forward to the discussion we're going to have going forward, and I look forward at some stage to welcoming you to Nairobi to continue this discussion and partnership. Thanks once again.
Good morning, viewers. Good morning, wherever you are in Zimbabwe, Harare, in South Africa, in Tripoli, in West Africa, Abuja, in Ghana, Accra, in Asmara, Eritrea. Good morning. Good morning in Cairo. Good morning in Khartoum. Good morning in Kampala. Good morning in Lusaka, Maputo, Rwanda, Gaborone. Good morning. Good morning in Nairobi. This is Punchline Africa Television, the only television station on the continent of Africa that discusses African matters, issues, what ails Africa, what kills Africa. Today we are joined by our comrades across the continent to discuss a common feature called COVID-19. COVID-19, which has brought challenges, obstacles, solutions. What are they? What does Kenya have in common with Zimbabwe? And what does Zimbabwe have in common as far as eradicating the pandemic is concerned? That is our topic this morning. And this morning, we shall call upon all our viewers, wherever you are in the world, to take a pen, listen to what the panelists will tell us. Those in Zimbabwe, you know this is a new disease whose owners have been very shy to tell us how it came about. You remember the Chinese have treated their people, but they have not helped us to treat ourselves. They have only sent us medicine. They have sent us drugs, boxes, ventilators, but they haven't told us what is it that made them. Did they kill all the people in Wuhan? That there were no patients who died more than we people dying on African continent? Those are some of the things I want my panel to dig deeper. Why is it that Wuhan, with a population of 8 million people, We don't see many graves. Students, Kenyan, Ugandan, Zimbabwean students who are in Wuhan have not witnessed mass burying, mass burials. What happened? What is this type of disease? It has hit everywhere. Almost every family in Africa is affected. You might not be sick. You might not be suffering from it, but your neighbor is doing so. So as a result, you hide in the house. Are you not affected? You are. If you are hiding in the house because your neighbor is sick, are you not affected? You are. If your child is not going to school because there is COVID, are you not affected as a parent? You are. If your working hours are from 6 to 6 and you are told to close your shop at 3 p.m. because there is a curfew at 6, like those people in Zimbabwe, are you not? That is what we want to find out and compare. What we can do better for Africa. What has Kenya done better than what Zimbabwe has done? Why is the Zimbabwean people have fewer numbers? What is the method of testing? Are they testing? What about the vaccine? When will it arrive? Do we take the vaccine? There are so many theories floating around there, my panel. So my panel is a wide bath. It's a wide bath. Not bath, bath. It's a white bath. You can discuss as far as Tehran, Iraq. You can discuss as far as America, New York, Washington, Joe Biden. What is he doing? You can discuss as far as South Africa, Ramaphosa. A lot of discussions, a lot of argument between Ramaphosa and Zimbabwe. Last week we had a debate which Amai Abigail missed. It was a very fantastic debate. Why South Africa says Zimbabweans are the ones bringing COVID-19, but they have forgotten of who I was listening to Amai about Abigail telling Magaza, because I understand Shona. He said we have ama COVID, ama flu. We have plenty of flu. We have forgotten about many flus, including one that has caught me now. There's a flu. You have seen me sneezing. They are flu, but it is not COVID. You get the point. So there are many ama flus. Then there are very many other obstacles. Medicine. How do we get the medicine? Many obstacles. Medicine. How do you get the medicine? Ventilators, the beds, hospitals. How are the hospitals coping up in Zimbabwe and the hospitals coping up in Kenya? Thank you. That is the basis of our topic this morning. And we compare notes, take notes. Many of our governments are watching. Government officials in ministries whom I have tagged this morning on my WhatsApp are watching to see what response is coming out of this debate. It's a healthy debate because we don't know when will this end. How does this affect the politics of Africa? We have seen some countries holding elections during COVID-19. But are these elections real elections? When there is an election, you must go and convince people about your manifesto. So, was this an election? The elections that we have held under COVID, where you cannot, where somebody who's talking to you has got has got this mister here. You have to put on this in order to approach anybody. And this is now the norm everywhere, in planes, anywhere. How many people are wearing this? What is the inconvenience of wearing this mask? When you want to drink water, you have got to drink, you say, oh, sorry, you have to take out. But this is the only way that you have got to survive. And how many people are teaching people to survive? How many people are washing their hands in Zimbabwe? We Africans used to wash our hands before we go to sleep to eat. How many of us leave the toilet? If you watch very many men in all nightclubs, either Zimbabwe or Kenya, when they leave the nightclub, they have not washed their hands. And then they come to greet you, oh, Mudara, how are you, Mudara? And you know you are spreading disease. It is not only in Zimbabwe, it is happening in Kenya. Most of the people, women, at least women try, but women have very bad behavior. So these are some of the things. How many people are permanently using this? How many families have been affected? What can we do? What about our economy? How many people are paying rent? How many landlords are locking people outside? What can governments do to remove these obstacles of a landlord coming to say padlock after padlock, padlock after padlock? You know, it is that song is party after party, but now it is padlock after padlock. When I wake at the first padlock, they put the first padlock, second padlock, fourth padlock. So even if you bring a hacksaw to cut to cut the first padlock, you won't be able to finish. So thank you very much, viewers. I want now to take this opportunity before I hand over to Miriam to introduce the panel from Zimbabwe. Thank you very much. Amai Abigail Mupambi, can you now greet the people? Abigail, we can't hear you. Stephen, you can,
Very much. Thank you so very much, Doc. Thank you so very much, panel. And of course, it's a very good morning to you all, colleagues and viewers. Thank you.
Yes. Below Abigail, we have Mr. Magaza. Mr. Magaza is one of the senior veterans in Zimbabwe. He has been on our panel. Greet the people, sir.
Thank you, Dr. Matsanga. Good morning, viewers. Good morning, panelists. Good morning, everybody. Thank you for having me today.
Thank you. And with him, the team leader is Saxon Vina.
Good morning, viewers. Good morning, Doctor. How are you, everyone?
All right, very well. Thank you so much, Saxon, there from Zimbabwe, Harare there. Are you in the capital city of Zimbabwe, Saxon?
Kiambu South, Gatundu South.
Yes, yes.
Hello, good morning, good morning, viewers. Good morning, fellow people from Zimbabwe. How are you, Abigail? Yes. And Mr. Mangaza, how are you doing?
I'm good.
Good morning, good morning.
You will greet them later. Now with that, I have Kirimi from Meru.
Good morning, Doctor, and also to our panelists, and thank you for having me on the show.
Thank you very much. Then lastly, we have Javani Karanja from Nanyuki. You see, Nanyuki is like a Rupane. Nanyuki is like a Kariba, the basket. Which area in Zimbabwe is the basket of Zimbabwe where Mashonaland Central and the Mashonaland and the Midlands, where they grow a lot of food. So Karanja comes from those areas that feeds most of the people of Kenya. Karanja, welcome to the show.
Thank you, Dr. David Masanga, for having me on the show. Good morning to our viewers, or good afternoon from where they are watching us, and good morning to my fellow panelists. Thank you for having me on the panel. Thank you.
And the rest now, I hand over to Nairobi. Miriam Ogutu, our senior anchor, senior presenter. Thank you very much, Miriam. Take over from here. I don't want to be like a Paul Obiya to stay on power, even when it is going. I'll hand over this to you for you to moderate this show. I don't want to be like a Mr. Museveni across the bridge, even when an election is flawed. He just wants to stick to power. And to talk about Uganda before I leave, I think we have constitutionally written very good English in the filing which we have done. And we told people not to go violent, to stay calm, petition. For us, we abide by the law. When the petition comes out in our favor or in the favor of the government, which we know will not come in favor of the opposition because some of the judges saw the beatings, the harassment, the shooting, but they will not vote. They will not give us a verdict. But we wanted it to play in the public domain. We wanted Miriam and Kirimi and Abigail and Magaza and Marine and Javani Karanja and Saxon and Matomai Motion to help us. We are playing on international high range that people will know the mistakes what happened. That there are some polling stations, Miriam, where 5 kilometers away from the Chambogo returning center, where the returning officer, they have not received the votes, the ballot papers. So do you call that an election? Where 5 kilometers away from the headquarters of the Electoral Commission, the ballot papers were not delivered. So these are some of the challenges that we have. But I thank you very much. I hand you over the baton. Take it over. I will be listening and coming in and out, and making my point at the last, and I will come to summarize. I believe all of you will enjoy the show. Thank you.
Definitely. Thank you so much, Doctor, for that introduction and, of course, the events there in Uganda. But that is a story for another time. Today, what we're looking at are the obstacles, challenges faced by Zimbabwe and Kenya in the fight against COVID-19. And some of these challenges, I'm sure, are quite synonymous with a lot of African countries. So just a little background on what is happening. Of course, the first case in Kenya was confirmed on March 12th, 2020, after a 27-year-old woman tested positive for the virus a week after returning from the United States via London. That was last year, almost a year now. And Kenya became the first country in East Africa to test a positive case for coronavirus. And as we speak today, the confirmed cases in the country stands at 100,856 cases, and the death toll in Kenya is at 1,766. Recovery so far is at 83,936 cases. And of course, we move on to Zimbabwe and see. And on the 21st of March, last year, 2020, Zimbabwe reported its first COVID-19 case, a male resident of Victoria Falls who traveled back from the UK via South Africa on the 15th of March. No deaths had been reported initially, and 2 more cases in the country were confirmed on the 21st, both in Harare, and on the 23rd of March, it was confirmed that noted Zimbabwean journalist Zororo Makamba was the first person in the country to die from the coronavirus. And as we speak today, the confirmed cases in Zimbabwe stands at 33,548 cases. The death toll is 1,234, and recoveries right now in Zimbabwe stands at 26,580 and 583 cases there. So what I'd like to know, and perhaps to start us off this morning, and I'll start with Mr. Maganza. I don't know what is the situation in regards to COVID-19 there in Zimbabwe, and do you think the government has done enough to with its effort to fight COVID-19?
Thank you so much, Miriam. There is a lot of panic among the Zimbabwean population in relation to COVID-19. Of late, I'm sure the world read that Zimbabwe imposed a 6 p.m. to 6 a.m. curfew, as well as other tough measures to make sure that people are not able to move except those whom they consider to be in the essential services, especially probably the security sector and the health sector in particular, and then others, as well as the banking sector. But the rest were asked to stay at home. But the situation on the ground is not as is, because considering the Zimbabwean situation, we have got a lot of challenges, especially economical, whereby almost 90% of the population survives from hand to mouth. And then the other 10% is the one who just got a job whereby they are guaranteed of a salary. Now, considering that we are past a month and then into the other 2 weeks of the national lockdown, we find out that a lot has affected the common man, and he or she has got to endure for these other 2 weeks, while he doesn't have any meaningful income or income which to use to buy food for the family and whoever survives on him or her. So it's a big challenge which we do have in Zimbabwe, and there's a lot which we feel has to be done or should have been done, so that at least the situation should not be as it is by now.
All right. Thank you so much, Abigail. Mr. Maganza saying that, of course, a lot of people have been impacted, and also finishing his thought there by saying that there's still more that could have been done. And so maybe what is happening right now could have been averted. I don't know. What are your thoughts on how the government have handled the COVID-19, owing to all the challenges and everything else that the country is dealing with right now? Abigail.
Thank you so very much, Miriam. But my thinking is that by now probably we could be in a position of understanding better the issue of COVID, and probably have less of panic and begin to realize that COVID is here for a time that we all don't know. Probably we need to survive with COVID. But at the moment, as things stand, you realize that there is too much of panic, which I think also where everyone is to blame, because people are speculating more on the negatives than the positives. And I think also in this time of COVID, we have also managed to find ourselves as nations, as Africa, because right now we are realizing that we are going back to basics. What do I mean by going back to basics? We are beginning to revisit our usual ways of probably dealing with these flus. We are going back to what we call Zumbani here. Mr. Mangaza remind me of the English word. I grew up actually also using Zumbani, but with the modernization gospel, we ended up thinking that using such issues was demonic to some extent, not very effective. But we are finding ourselves as Africa, because we are going back to home remedies. We are now going back to ginger, garlic, and of course, all these methods that our elders used to use. I think it's a time to reflect. It's a time where we also need to say, can we do something within ourselves, within Africa? Can we modify something within ourselves and begin to realize our strength out of this challenge? And I've seen this happening. Coming back to the issue of the curfew, Miriam, it's a challenge. As you know that Zimbabwe has been running with almost over 60%, I'm not sure of statistics, of our economy being the informal economy. So I think by now, I wouldn't blame government probably not making it at first, because Corona is a disaster. You can't actually, no one had planned. I don't know from China and America, their accusations, we had planned for it. But as for Africa, we are victims. It was an accident. It's something that we had not prepared for. But I think having gone through a year plus with this Corona, by now we should be able to have mitigatory measures to say, how do we meet the people halfway? Because considering that our people, they work in the morning, eat the produce, the profits or whatever in the evening, we need to make sure meet the people halfway. As a human rights defender in my own way, I feel that when we talk about the life and the valuing for life and the importance of life, we always have this saying of saying dying is dying. And some people are beginning to adopt it to say, even hunger can kill me. You get what I'm saying? Okay. So we must now strike a balance between this issue of COVID and the issue of poverty. Because at the end of the day, we are talking about life. So which one will kill the people probably faster, and probably they'll talk about the figures, what proportion versus COVID and poverty. So we want to strike a balance and make sure that we meet the people halfway. Okay. By now, I know that there are so many ways, probably the IMFs and other funding institutions should be coming on board. But here is the tragedy, Miriam. As things stand right now, I was reading a very disheartening document. One of our own, and the opposition leader, I will not shy to even say the name, Tendai Biti, trying by all means to convince the world to turn against helping Zimbabwe at this moment, particularly creating the very same rhetoric to give an impression that here people will be chasing after stealing probably the funds or the help should we get any help. What the world has to know, I've been in the civic society sector. I am not denying that we can have loopholes here and there as government, as stakeholders. But most of the funding from the UN agencies in particular, they are managed through their own agencies. It is the UNDP, UN OCHA, UN Women. We have got these agencies responsible for managing. So should there be any illicit, these people will be the first responsible to answer. Why would you want to convince the world as if the money will come and just be put in a basket? People begin to chase and probably loot in that context. Okay. So it's disheartening, Miriam. I was reading this morning. It's disheartening. We cannot deny Zimbabwe or isolate Zimbabwe from any assistance that may be coming our way or that should come our way. It's time to stop politicking at this juncture. People must begin now to focus and helping out the people. Everyone's eyes right on the board to help the people. Thank you
so much, Abigail. And it is interesting that you should mention what Tendai Biti said. Remember, last year there was a bit of read some news also from Zimbabwe about is it a company or an entity that had been given the tender to supply the government with some COVID-19 supplies. I think the protective gears and all that was required in line with fighting COVID-19. And this tender was given to somebody that was in very close relationship with the president's son. So it is through this relationship, according to the story I was reading there, that influenced them getting this tender. And after getting this tender, they supplied the government with very overpriced, prices of these very important commodities, and so that became something. I think the government also was investigating that incident. So don't you think through that maybe, I know this is not the time you want your country to call even sanctions on your country. It does not make any sense. So on that one, I disagree with what Tendai Biti, but is there no clear reasons for valid reasons for somebody to worry about corruption when it comes to these things in the country and perhaps being misused. We're having the same situation here in the country in Kenya. We also had the COVID scandal here. People overpriced these things, and now it is something that you're dealing with, and investigations and underway. The government of Kenya has made it very clear the culprits, the law will go after them, and they will be accountable. So should that not be the same thing there in Zimbabwe? Saxon.
Before Abigail answers, I think I have a full story on what happened and what Zimbabwe government took steps. One, the Minister of Health was sacked. Show me one African country that has sacked the Minister of Health.
Zambia, I think.
No, name mentioned, very few. Zimbabwe took action as a result of problems overpricing of tenders, sacked the Minister of Health. Am I wrong? Magaza, Saxon, and Motion Matamai.
Correct, yes.
Correct.
Was fired. And the entire PS, everybody was told. And he has a case, not only fired, but he's going to Chikurubi. You know, Chikurubi is the committee, the committee of Kenya.
The maximum prison.
The maximum prison. So, Miriam, that does not justify a man.
I was going there, Doctor. I was still building my case. I was getting to a certain point.
Yeah. So that one is the point I wanted to bring to you.
Yeah.
That there was action taken. Okay. So Tendai Biti cannot use that
as an excuse to call for sanctions.
Zimbabwe's ability to borrow money for.
Very well. Very well. Thank you so much, Doctor, for that clarification. As Saxon, of course, what Abigail there has said, now there seems to be, instead of efforts being put together in the fight against COVID-19, some politicians have taken this opportunity to try to politicize the whole thing around COVID-19. What do you look at? How do you look at that situation?
Yeah, that is pretty bad, but that's the nature of the kind of opposition that Zimbabwe has. They celebrate the sufferings of ordinary citizens to score cheap political goals. At this time of crisis, people should take away political jackets and fight this pandemic. But only last week you were celebrating, blaming the government for the deaths, but it was the one who even advocated for not to get funding. I think
we apologize.
As compared to the team got 45 million, whereas an economy like South Africa got
we apologize for that. Saxon, we are not able to get you.
The pandemic is
we're not able to get you clearly. I don't know what you're going to do with your signal because it's disrupting the whole thing. So I'm not sure.
How about now?
Okay, go ahead and see if it will make a difference. Go ahead.
Okay. I'm saying that was pretty bad, but that's the kind of opposition. Our opposition, they celebrate anything that place the blame on government, despite it being natural. And what Tendai Biti did, which is in the public domain, is not the first time. It's what he's used to. You would rather demonize the government and make people suffer. And they're even celebrating the deaths of even some officials, not knowing that death is it's something that everyone will go for anyone. And that's the challenge that we're having. Our situation has been politicized, and people, instead of coming together, putting their heads together to fight the pandemic, they are putting the blame and even throwing spanners in the efforts of the government. And that has made the situation dire, especially for the urban populace and everyone else.
Okay.
Because we're entitled to get the funding from World Bank as we're a member, but someone wrote to the World Bank and said, don't give to Zimbabwe, and which is really mind-boggling.
Okay. Thank you so much. I think, I agree with you. This is not the time for anybody to want to call on sanctions to be given or help to be denied to their country. And even as we speak, I think a couple of minutes ago, I saw another news item of UK sanctions for Zimbabwean security chiefs over a rights violation there, and that is new sanctions again against some Zimbabwe leaders there, but that is a conversation for another time. Now, on the 2nd of January, the government in Zimbabwe introduced a 30-day curfew along similar lines as in July 2020 in an effort to curb rising infection numbers. On the 13th of January, traditional funerals were also banned. Now, a series of notable COVID-19 deaths occurred in just 10 days. Lazarus Takawira on the 12th of January. He was a ZANU-PF youth leader. ZANU-PF youth leader Lens Ruizi, who also died on the 15th of January. State Minister for Manicaland, Ellen, I can't say the other name, it's just too much, on the 15th of January. A freedom fighter and nationalist Morton Malianga died also on the 15th of January. ZANU-PF Information Secretary Ronald Ndava on the 17th of January. Former Reserve Bank of Zimbabwe Governor Kombo James Moyana died on the 18th of January. The Minister for Foreign Affairs and International Trade, Sibusisio Moyo, died on the 20th of January, and the Minister for Transport and Infrastructure Development, Joel Bigi Matiza, died on the 22nd of January. Former Minister for Education, Sports and Culture, Ananias Chigwedera, died on the 22nd of January, and former Commissioner General of Zimbabwe Prisons and Correctional Services, Paradzai Zimondi, died also on the 22nd of January. And of course, 3 members of the cabinet of Zimbabwe died in the first 2 weeks of January because of the pandemic, adding to the death of Cabinet Minister Perance Shiri, who died last year in July. So we've seen that Zimbabwe has been hit, especially the cabinet there of President Emmerson Mnangagwa, and we know there has been Zimbabwe's health system is not at its best right now, and we know that the country has been doing all it can to try to address this matter. And just so how would you say the government has dealt with that? Are we having somebody else from Zimbabwe? I know we've had all our Zimbabwean brothers and sisters go there. So Marlin here from Kenya. We know that Africa recorded their cases much later compared to the rest of the world. And there had been arguments that perhaps Africa should have seen what is happening in the rest of the world and then tried to stop the flights much earlier, start putting measures in place to ensure that we don't get the pandemic. But as it is, we live in a global community. We have to continue with trade. We cannot stop the travel and all of that. And so here we are dealing with the pandemic today. Do you think there's anything we would have done and maybe we would have gotten a different result?
Honestly, the first few days when the whole thing started, everyone got very worried. We cannot blame anyone, especially because the government kept telling us to take precaution, make sure you don't move around that much. Warning was given out there. We really can't blame anyone in specific, but later measures were taken that we can appreciate. And so far, our health ministry is doing a lot. Maybe together with the citizens, we are trying to cooperate to be one in this, even though it's hard as it is, and unfortunately for those who've lost relatives and their jobs, a lot has been lost. Yeah, we are really trying to recover from that, and unfortunately, here Zimbabwe is currently is facing it right now the hard way. What we can tell you is it gets better. It's just that as soon as people cope, it gets better. Mm-hmm. Yeah, so I don't think there's something we really could have done because it was not it's something that came abruptly, I think the government did the best that it could have done. And also I'm sure everyone else did as much as they could.
Okay. All right. Thank you so much. Now, Douglas, we know one of the key things that has been a challenge, especially in the rest of the African continent, I think, is the limited testing capacity. And currently the continent testing rate is one of the lowest in the world. How do you think this has affected the Kenyan situation, and how do you think the government has handled the situation so far? Douglas?
I think the government, thank you, Miriam, and I also think governments in Africa have tried, because the predictions were that in Africa we are going to experience multiple deaths. People are going to be sleeping on streets and also dead, and we should be burying people in multiple numbers, but we have not been able to do that. I think governments have been able to put containment measures across Africa that have been able to contain this virus, to the chagrin of the West, when they thought that people in Africa are going to be responsible about their health and all that. So I commend government in Zimbabwe, in Kenya, and all of Africa for their profound response to COVID-19, and also health ministers and also the frontline workers across Africa. Because were it not for the frontline workers and also for the presidents who have come out to stand for their country and also defend their people against this virus. This virus is not something that we can say is something like corruption, that we can be able to wake up and decide now if anyone today is found corrupt, we can be able to hang them. This is a virus that came from China, like the former president of the USA is a Chinese virus. It is not something that we brought on ourselves. It is something that was brought on the people of Africa, and this is a foreign phenomenon. We have never had something like COVID-19, so there is no one really that can say that they have experience in managing COVID-19. COVID-19 is an health emergency that has come upon the people of the world, and as a people of Africa, as people of goodwill in Africa, we should support each government in Africa to continue visiting positive response upon their people, and also to continue delivering good health care to their people, because this is an health emergency, like I've said, and at the end of the day, the people of Africa are going to overcome, and we have seen the response in Africa, especially from Zimbabwe and from Kenya. It is very positive and also something that can be emulated even in future, and even beyond Africa. People can see what we have been able to do and what we have been able to deliver for the people of Africa. And my thanks to the government and ministries of health across Africa, and also the frontline workers. They have done a commendable job, and also to the citizens who have been able also to observe their containment measures, mask up, and also take precautions to avoid this coronavirus. Mm-hmm. And also thanks to everyone, because this is an health emergency, like we have seen, nobody has had an experience during this coronavirus. So Miriam, for me, this is something that I think that we have done well as Africans, we have done well as African government, and even as healthcare system. Remember, they thought that we are going to die in multiples, but we have not experienced the death like they have. We are not wishing or visiting death on them, but they have a clear picture of what is going to happen in Africa. But God has protected us. Containment measures have been able to work for us, and here we are fighting this virus, and we shall overcome it.
Mm-hmm. All right, thank you so much. And the latest, of course, from the Ministry of Health yesterday, what CS for Health Mutahi Kagwe told us is that 83 people had tested positive for the virus from a sample size of 1,732 in 24 hours. This represented a positivity rate of 4.7%. The new cases comprised 46 men and 37 women aged between 6 and 88 years old. So what you're seeing, and what we've been seeing, especially in Kenya, we've seen a downward trajectory, and right now I think we are about is it 5% positivity rate there, so which I think it's a good thing. But is it too early yet to celebrate, Javen?
Thank you, Miriam, for that question. And I think it is not too early to celebrate, because we have seen the kind of political games that have been ongoing. We have seen the politicians holding political rallies without observing even the slightest protocols from the Ministry of Health. Therefore, we should not celebrate, but we should keep on ensuring that we follow the protocols that have been laid down by the government to curb the spread of this disease. So far, so good, because the rate of infection is quite low, but we are not out of the wounds yet. We are still there. And it's high time that we keep observing, and the government should continue ensuring that Kenyans adhere to that and to other government. And one thing that we have learned a lot is the issue of COVID-19. This is something that nobody was prepared. This is a pandemic. This is something that came. It is a crisis all over the world. And I think nobody should be so much blamed, especially in our African continent. But what the government should have done is to quite ensure that this should be a lesson. In future, they should be prepared enough, and we should have good healthy facilities where we have good equipment in the ICU facility, so that we can be able to deal with that kind of emergencies. I think this is a wake-up call to our government that they should make their healthy facilities a priority, because we have seen how government officials have been affected by this disease. You know, in Africa, we have political elites who think that they will not develop their country because they can run to India and other countries to get treatment. But coronavirus have outright that, and they have now been left with a mindset that it's good to build on your country rather than investing in things that will not add value to the people. And that is on the health facilities, to ensure that every universal health care should be a priority to all the governments in Africa. Therefore, on the issue of COVID-19, it's a wake-up call to the government. But we have seen the blames that have been happening across Africa from the opposition. People are celebrating when others are dying. This kind of political immaturity should come to an end. We should all combine our efforts to fight this disease, and later we can talk of politics, because we have seen even in this country, when we had the COVID-19 scandals where money was alleged to have been lost, we saw other politicians celebrating and pointing blames to the government, and that should not be the case. This is a time to combine efforts, and people should not take advantage and use the loopholes that are there in the governments to champion for their own political interest and to poison the people against the government of the day. Because what they are doing, they are taking advantage of the situation at hand, and they are blaming the government for the economic stagnation. And this is something that is a global menace that is affecting all the countries in terms of economics, because the lives have been affected, jobs have been lost, business have been shut down. Therefore, the opposition and the civil society, they should not use that as a route to condemn the government of the day, but they should also bring their ideas so that we bring a good countries in Africa without shifting blame, but everybody should be held accountable for what they did in this time of crisis, because leaders are known in times of crisis, but those who are not leaders, they come to celebrate and to point fingers at others. Thank you.
Thank you so much. And of course, we're also joined by Ambassador Maina Ghana. Ambassador, very good afternoon to you. It's afternoon here in Nairobi, a few minutes past noon.
Hey, afternoon to everyone.
All right.
I'm seeing my fellow African comrade from Zimbabwe.
All right. Very well. Thank you. And we're happy to have you on the show today.
Good morning, Zimbabwe. Good morning, Dr. Matanga.
Okay, Ambassador. So there has been a lot of conversation about Africa had some time for it to ensure that, COVID-19 does not come into the continent, because I think while others were suffering, we still had some time before it was reported. The first case was reported in the continent. But be it as it may, we have COVID here with us. How would you rate how the leadership of this continent have been able to show leadership, basically, in terms of COVID-19 and the fight against the spread of this virus?
Well, first of all, we need to congratulate our leaders, because they cannot stop their boss to come in Africa. You know that. Even when there was COVID-19 in Europe, America, or in Asia, we did not have the power to stop them right away, because they are our donors. You know that. With all the problem, they are the ones send us the COVID-19, but they are the ones sending us money, right, to help our African countries. So meanwhile, we don't have any power on that. Right now, many countries are relying on them even to survive. We are waiting the donors, because we say that our economy is down in many countries, so we don't have the power to stop them. The only things we can do to try to do as much as possible to put the measure, at least we cannot spread the virus. For example, in my country, we don't have a lot of cases. We have almost 4,000 cases. Why I have understood that? Because people was focused on different things than the COVID. Sometimes the fear of the disease can bring a lot of disease than even disease itself. Yeah, fear is bringing a lot of things. You can find out when you investigate. Even many people who are dying in Africa did not die for COVID. They died with the fear of COVID. Because right now, we all know that in any African hospital, when you go, you are coughing, you fear to go to the hospital. Am I right, Miriam?
Mm-hmm.
If you start coughing, even you have something else, you are scared to go to the hospital because, the nurse would say that, no, that's my brother, is not doing you well, let's test you COVID. The moment they start testing COVID, the blood pressure start going high, and if the person die, they would say it's COVID-19. Sometimes it's not. The fear of disease also has put a lot of pressure to our brain that now a lot of things are not moving. But at the end of the day, we need to understand that we have to live with these things, either we like it or not. It's going to be our daily life. We need to understand how to manage it, how to, go about it, how to make sure our healthcare system become more efficient than before.
Mm-hmm.
The proof has shown that for us, Africa, we are just lucky, like our friend Kirimi Budi is saying, God with us. That's why, but we cannot say that we have a very healthcare system in Africa that can contain this disease. That's not true.
Mm-hmm.
All of us know that. Now, what is the way forward? That is how we are going to think about it. Are we going to come together as Africans to build an emergency response teams that in the case those kind of things happen, we know how to react on them? Do we have a team of research and development and to make sure that in those kind of diseases, we can prevent them in the case that they come, we will have at least a gateway, to make sure that it cannot affect us as Africans. This is what we want. But if we stay waiting the donors, to send us masks from China or something, at least something is not doing right until now. And I don't know, you guys can tell me, there is no any African country has been able to help its fellow African with this COVID. And this is spending me so much. Why are we expecting France or UK or America to send us help that we African, we can help each other? We from Chad, we can raise some money to send in Zimbabwe. Zimbabwe can send in Kenya to say this is our contribution to the community, the mask or something. We did not do it. Why we cannot be in Africa to do our own mask and send it to another countries? At least to show the support of among us. Why expecting those white people to send us everything? And after when they give us sanction, we will complain. Why are we expecting that? We can create our own system that in the case there is a problem, we help each other. We say, okay, let's say Chad is more affected. We, the 53 countries, do we have any way to bring a solidarity, to send our nurses, to send some medical equipment, to send some masks in Chad? At least, we can ease the burden, even though the Western countries can come, but we Africans have done something similar.
Right.
I did not see it until now. Maybe you can tell me, Miriam.
Mm-hmm. Okay, I understand. I get your point. Thank you, Ambassador Maina Ghana there. He's from Chad, I believe.
Miriam,
yes.
I want to come in. Okay. I want to, first of all, welcome Ambassador Ghana Maina. Mm-hmm. The points you have raised are very serious. In fact, I had not thought of one of the points that you are raising. Up to now, there is no African country that has helped the other. All of us are looking at the United States or America, or Britain or France or China. But we don't have an African cooperation. I agree with you. 2, there are members on the panel, on the chat, who are also chatting. We are chatting with people, I want to tell them, Clifford, we are chatting with people on the ground in Zimbabwe. Abigail Mupambi is on the ground. Magaza is on the ground. Saxon is on the ground. We are not doing it from Nairobi. So don't think we are talking from Nairobi point of view. These people are Zimbabweans in Harare. And they see what you see. So if you see what you see, which is not seen by them, when they see it, then you have not seen what they have seen. I don't know whether you understand that. I have brought you to philosophy. If you have the ability to pick, you can pick. But I'm saying we don't have any problem. We are relying on this gentleman and the lady to tell us what is on the ground. Mm-hmm. Miriam, on a serious note, let's bounce back on the topic. COVID-19 started in Wuhan. The guys in Wuhan don't die. We have died. We have not seen graves in Wuhan. I have 2 Ugandan students from my district, my clan. They haven't gone any near the cemetery where they have seen any COVID burials in mass. Now, the whole COVID-1 vaccination exercise is a worry to Africans. And I'm sure Maganza and Mupambi Saxon will tell you that it is worrying everybody in Zimbabwe. There are people in Zimbabwe who are saying, no, we don't want the vaccine. There are those who are saying, no, we want the vaccine. There are people who are misleading people. There are those, because the World Health Organization, Miriam, they did not deliver. 1 year ago, Miriam, and I'm proud, I want to sit here, 16 days to come. And God is watching here. I saw this coming. I wrote a letter to all African heads of state. President Mnangagwa got a letter, so you will not tell me he didn't get it, because it went direct to his phone. He read it. President Museveni read it. President Uhuru read it. I wrote a letter and I warned Africa. I said, Africa, we have a problem. The man who even replied to me was Kagame. I have the reply with me. He said, comrade, you have raised very serious points. I said, prepare yourselves for a tsunami, which was coming. We don't know how to stop it, but it was going to land on our land. It was going to kill people. It was going to punish people. It was going to destroy families, their families. One of the problems that Africa, the obstacles and the challenges that every African state has is stigmatization. You have forgotten that. You are not looking at an obstacle. If, for example, Kaina has said, if you just go to hospital now and cough, you're automatically sentenced to death. Yeah. Why are we not talking the truth here?
Yeah.
If you cough, like now, if I was in the studio where Miriam was, I would have been sentenced quickly to an isolation hub. Maybe what Amai Mupambi said, Ama flu, plenty of flu is flowing, which could not be COVID-19. But a mere cough nowadays, a mere cough will land you to a quarantine at any airport in the world. You pray that you don't land around Heathrow and start saying, if you say that, they will pull you out of the line and you are in a quarantine. Stigmatization. It is taking place. And Maina, several things we argue with you and we go wrong, or we fall apart and even don't talk for days and then talk later, which is very normal for me because you are younger than me. What will you do? Nothing. I will always come and tell you, Maina, pick the phone quickly, isn't it? And talk to me. One of the things you have done is this, to bring this out. We are stigmatizing our own people. That is the letter I wrote, Matsanga Leaks. I penned this letter on 18th of February last year. 16 days to come, you can read it. If I was wrong, go and remove 1 degree from my PhD, burn it in the daytime in Harare. Burn it with fire. Google that later. Whatever I predicted has come true. Because I went to school to study, not to look after the building and the headmistress. Because most people look at either the headmistress, like so many churches today in the world. When you see a pastor who is a woman, we intend to look at the way she is walking, and instead you forget God is around. You see, that is one of the things that has made me speak out my mind. We stigmatize people now. So many people are fearing to come out. Because if you are seen in the clinic with a mask on, or with this thing is what? The what? Oxygen. Even, families are breaking down. Women are running away from husbands. Mupambe. It's true. Husbands are running away from women. This thing is affecting families. Those are the things I'm wanting you to discuss here. To see what has Zimbabwe done? What can we do? What has Kenya done? Kenya's sampling system. Kenya's system. Remember Kenya's system of what can looking for people who have COVID is very robust. Yes, very robust. Have we slackened? Why have the numbers gone so high? The Kenya's curfew starts at 10 o'clock. Zimbabwe curfew starts at 6. I want Zimbabwe people to tell me, Mr. Magaza and Mupambe and Motion and Saxon, is this curfew beneficial to the economy? Don't hide things under the table. This platform of 2 hours is not to hide under the table. If you want to hide, you hide under your car, Mr. Magaza, and hide under the tire. But don't come here and don't tell me that you are closing the economy at 6. To 6. All people must be in the house. What type of domestic violence are you expecting? Especially given that African men beat women. School children have not gone to school for many years. Pregnancies. When men are not working, they look at the younger children. There are some pedophiles walking around our cities, hammering our children. These are the obstacles. Matatu, which is mean this manaba. In South Africa, they call them manaba or whatever it is. How are you experiencing when you climb a matatu? At your workplace, Mupambe, you have workers in your office. How many of them? Another point, Gaina Maina, and which I want you to look. How many people are willing to go for a test? Naona the panel is going to become smaller. When you tell people to go for a test, they run away. It tells you, no, I've not been coughing for a long time. So what? You could not be coughing when you have really hammered it is inside you. You are the one spreading on the glasses, on the tables. Go for a test. How much does a test cost in Zimbabwe? $100. How many dollars?
Free of charge.
In Zimbabwe, it's free of charge. Have you seen Miriam? These are the things that I wanted us to bring up. In Zimbabwe, the test for COVID is free of charge. In Kenya, the test is 10,000. Why are we not speaking, man? Walaya Mungu. In Kenya, you must pay 10,000. How many Kenyans have 10,000 shillings? When you have 60 children in a one room, before you can meet your wife, you have to tell some children at midnight to stay outside. These are realities. And the people are not talking here. We are not glossing over this, oh, what is happening in Zimbabwe. Apana! It is here. It is here. 10,000 shillings for a test. Zimbabwe is free. Let me see anybody talking from Kenya. Niambie. Are you happy with 10,000? Yeah. Are you happy with 10,000, Miriam? Where you are, you are a family of 5. You are supposed to cost 50,000 shillings. I am giving an example. I am not saying you are 5. If you have a family of 5, that's 50,000 to go and check. Okay. If the results come, 55 of you all have hammered a word called COVID. You are positive. The amount of drugs that come with the 5, you can even call God quickly to take you away. Kuambiane ukweli. And those are the challenges, the obstacles. Those are the things that I wanted us to discuss on this. That's why we brought this topic. Can Kenya learn from Zimbabwe? That Zimbabwe test is free. You pick your nice shirt, like a kid. If you go to Kenya now, take it. It's your certificate. Nobody has it. No, people don't have it. Yes. And then they keep on telling you, I am all right. I am safe. I'm safeguarded. I am safeguarded. I don't cough. Well, you might be the transmitter. So people fear now. They fear even now to tell others that they have workers. You fear to tell a worker, Miriam. You fear to tell somebody that I have 10 workers, because the question that comes, have they tested? Have they gone to Nairobi hospital? Have they gone to Paranya? Is it the hospital in Zimbabwe is called? Parinyatwa Hospital. Nobody can employ you today without a COVID test. Nobody can give you a house without a COVID certificate. Am I wrong? Some people are applying these things very seriously. You want to change the house where you used to live. The man said, Angalia, this guy has COVID. Have you got certificate? So, why we brought this topic is to discuss how can we help a country like Zimbabwe has managed to restrict, and it has very few numbers infected. But it has one value, despite the problems it has. It charges its people for testing. A country with an economy called Kenya, the giant of East Africa with an economy. Miriam, that's the perspective I'm looking at. A country like a Chad of Gaina Maina with 4,000 cases, what can they help us? Because most of them are nomades. They live, Maina, don't tell people you have big houses, flats. Sorry. Maina, you are a nomad. Okay. A nomad from Chad. I don't want to describe it higher than that. But you are a nomad from Chad. That's why the spread is not too much. You're always in the open air, fresh air. But for us who enter houses every morning and the town in, out, a lift there is full of chaos, Miriam. The bus is full of chaos. But Maina's people are all over. With their cows. So, Miriam, I am saying, let's centralize the debate. Schemization, lack of money to test can cause a danger. And I agree with Mahina that what is killing people today is not the COVID itself, but the fear of COVID.
Okay.
The other point I want to make, where did these other diseases disappear? We have HIV/AIDS. Where did it go? We have other diseases, malaria. Where did they go? Who invented this thing called COVID? Then malaria disappeared. How many people these days suffer malaria? I know Zimbabwe, you don't have mosquitoes. Zimbabwe, you don't have mosquitoes.
They are there mostly in the lower.
In the remote, yes. Near Kariba Dam, where water is, stagnant water. But in normal urban areas, you are a malaria-free country. That's why you have a yellow fever and other things. In Zimbabwe, when you enter a plane going to Zimbabwe, it is sprayed like going to Britain. If you have ever gone to Zimbabwe, they have to spray the plane. They say, cover your nose, go. Then they say, go. Our plane is here. For us, when we are going to, wherever we are going to East Africa, we go with our mouth even open, nose open, ears open. Okay. My submission, therefore, is this, Miriam. How much can we learn from each other's, in the second segment, which you are about to have? How much can we learn? What can we get? How shall we repair the economy after COVID? What can Zimbabwe learn from the hospitals of Kenya? What can Kenya learn from the free testing mechanisms? Has it enticed the people to come? Has it given incentives? How many Zimbabweans have been tested? Magaza and Amai Abigail have to tell us more about that. I thank you very much. I thank you, Miriam. Back to you. Let's face facts. Right. That one point has struck me of not.
But Doctor, so, one of our viewers here is saying that they went for the test in Zimbabwe and they paid $60. So perhaps, Abigail, you could clarify that for us.
The Zimbabweans are themselves here. I am not the one who said.
I'm saying Abigail will clarify that for us. Yeah. Go
Thank
ahead.
you. Okay. Thank you so very much. Maybe I can clarify it this way. One of my subordinates just went to a polyclinic. There are facilities that are there, so people generally they are not probably confined or forced to, just like what we do with even our private and public hospitals, to say you choose. But there are polyclinics introduced across the country, and even here in Harare, here in Matabeleland, there are such centers. They are advertised every day. So it may be a question that probably by the time these polyclinics were introduced, the message hasn't reached probably to almost everyone, or it's a question of convenience and probably the question of having that knowledge, which also serves in this platform that it's an opportunity I will share even on this network for this platform and other platforms. We have been sharing that to say there are polyclinics where you can go and test freely anytime. So that does not not stop other senders, of course, to have their charges, some private senders across the country to have their charges on. So there is such a facility, so you can choose. There's now options, unlike in Kenya, like we are getting it right now, that there's no such an option. That speaks also to the gap that we have to say we need to continue to decentralize the information, every key and critical information on the ground, so that everyone has got the information and the choice to say, where can I probably go, depending on whether they have money, or it's about convenience, or it's about the personal taste.
Okay, thank you so much. Sadly,
Miriam, may I add on that one?
Go ahead, Mr. Manganza. Go ahead.
Yes. Today, this morning, I was reading one online local newspaper. They were saying that we've got a town which is the east of Harare, which is called Mutare. They were saying that the free testing has become a hit among the population of Mutare, and people are going there in large numbers to be tested. And then those who they are encouraged to go for quarantine at their homes. And then when they experience symptoms which will be more than they will be expecting, they will be asked to go to the nearby hospital. So the free testing is there. Even here in Harare, where I am parked now, I am parked next to a polyclinic. People are getting there and then they are being tested for free.
All right.
Right. But what happens is that to those who want to leave the country, especially by air, because the roads or road ports are all closed, our land borders are closed, but the air travel, it is still there. They are the ones who go to get a certificate of clearance. They have got to go to certain laboratories to make sure that, and then they will be given a certificate. Those are the ones who pay.
Okay.
But if as an individual, as a citizen, you want just to check that you are COVID-19 free, you go to any polyclinic, as Abigail has been saying, and then you are tested for free.
Thank you so much.
Those who pay are those who intend to travel out of the country, by air travel.
Very well. Thank you so much. Or those who choose to go to
Miriam, additionally, Madam, is if your flight is tomorrow, I've just been sent a text from Harare, from a government official in the Ministry of Health, none other than the minister. If you are going tomorrow, okay, your flight is going tomorrow, you pay $60 to get your certificate that afternoon. But if you want to know your results, whether you are negative or positive, what do? Miriam, you wait, the government will give you the answer in a week, 7 days, 4 days, 5 days. That is how payment of $60 is coming.
All right.
The minister has just explained right now, he's my friend, and the people there know who the minister is.
All right, thank you so much.
Yes, that he has said, no, those who want quickly, sharp, which we call in Kenya, quick. Even in Kenya, there is express delivery. Am I wrong?
Can I add something?
Yes, go on.
Even though, let's say, it's granted that in my country that the COVID test is free, and you want me to go and spend almost 5-7 hours online just to do the testing if I can pay 4,000 Kenya shilling, because time is money, Miriam. That's why we are not moving in Africa. And you want me to come back the next day, stay 4-5 hours to get my document back. If there is in life, everybody don't have to be the same. Let us agree on that. If we don't agree, we are not accepting the reality. You can't tell me everyone in Kenya go just to, National Hospital here, at least to be on the line to wait. If you tell me that I can pay 5,000 shilling in 30 minutes, I get it. My 4 hours, I can make more than that, Miriam.
Okay.
Sometimes we need also to value our time, not even about money.
Yes.
Yeah, time is important also than money. Some people know that in order to why wasting 4 hours, if I can pay 4,000 Kenyan shilling right away, and I get my results.
All right, thank you so much. Thank you so much,
So-
Ambassador. So yes, we've had that clarification because one of our viewers.
In Uganda also, Miriam, it is 154 dollars. If you want to leave today, they will give you the results today, but you pay $150.
That's
If
good.
you want to wait for the government is 150,000 Uganda shillings. They pay also. So we in East Africa pay deeper. Yet, and now let's be honest, the point, Miriam, you brought very fast. Yet there was money being collected by the government in Kenya, which accountability is very important. And let's not sweep some of the things under the table. Corruption is everywhere. In Zimbabwe, the minister ate the money. But here, the hyenas ate the money. You know them. And they are still here. So Kirimi and us, we are battling all this corruption amidst a COVID-19. In Uganda, the money that Museveni lied to Uganda that is giving them food for free. That food only arrived 1 kilometer, not even a kilometer away from State House. It was sold 300 meters away. And all people in Kampala never received the food. Masks, he told us he will give free masks. At least one thing credit in Kenya, which we should give Kenya government, is the type of the masks, the production of masks, the production of sanitizers, which is very, very good. They did produce those things. I am very happy about it.
Yes, indeed. And right now, I think you can get a mask as low as 10 shillings. So it's very, very affordable. So because also now you're mandated to wear a mask when you're out there in public. That is a directive from the government and the masks. Right now in Kenya, as Dr. there has said, the production that was facilitated by the government has made it very easier for people to afford. I'd like for us to move on because time is really running out. Douglas, what do you have to add to that?
I wanted to also congratulate African governments, especially the Kenyan government, because the president of the republic made it to mandatory for people to wear a mask in public before even America came to effect that and other countries across the world, so that we can be able to contain this virus. That was the right step in the right direction for containment of coronavirus, especially in our country and also in Africa.
Absolutely. Thank you so much. And some of these measures that were put in place, we know even right now in Kenya, we still have a curfew that you should be at your place by 10 p.m. And I think it starts at what time? 4 a.m. to 10 p.m. at night. But we've seen a lot of businesses, especially that were being done at night, night travels, those have not resumed yet. So a lot of businesses have been affected. So now I just want us to perhaps, as we conclude, how some of these measures that are being put in place to protect people, but at the end of the day, they're affecting the other aspects of people's lives. How have people been affected so far, and is there anything that can be done to try to salvage the situation? And I'll start with you, Marlene.
Yes, thank you. To support what Dr. Matanga said about the testing, the paying for to get tested, yeah? Mm-hmm. That's one of the major things that's spreading the COVID in Kenya. Yeah, because people can't really pay for that amount to go get tested. As in, businesses are closed. People don't have money. So where are you going to get money to go and get tested? You see, people just hide about it. Also, fake papers have been produced. So that's another negative thing. So if you want to get a job, you have to get fake papers to go give to your maybe new boss. I'm really hoping the economy is going to go back to normal. As I've seen in Nairobi town, people are really, really trying to congest their working hours so that they can make up for the time that they are losing at night or after, especially most shops in town are normally closed around 9 on normal days, 9. Now they have been forced to close at 6 because if you have employees, they have to get time to be at their premises on time. Also, kids are being really sent home from school earlier than usual because of the obvious. So I'm really hoping, I'm seeing things are going back to normal slowly by slowly, which is a good thing. We'll cope, and God has really helped us in this situation. That's all I can say.
Absolutely.
And Africans, God loves us.
Yeah,
Yeah?
yes, I think it does.
Thank
very
you.
much so, because a lot of doom had been predicted that will befall this continent, but lo and behold, we thank God that it has not been that bad. Of course, it is something that we have to deal with. Douglas, as we conclude, these measures that has been put in place, how have they impacted the people, and how can we possibly make the best out of what the situation we have right now in ensuring we're able to normalize? Javen.
Yeah, thank you, Miriam, for that question. And the protocols that were put by the government across Africans, I can attribute the success in curbing the spread of COVID-19 to that, because we have seen a lot of positiveness coming from those measures, especially when the government in Kenya banned political gathering, and when people are restricted, when you attend burials, wedding ceremonies, birthday parties, there was a restricted to 10 people, and you must maintain a social distance. I think these are some of the things that we have come to learn through COVID-19. And there are some diseases through these measures that have been put in place to curb the spread of corona. Some diseases like this disease, cholera, and some other waterborne diseases that are brought by eating things are not clean. People nowadays, they are washing their hands, regardless whether it's COVID-19 or not. People have that, have become a normal to wash your hands when you're visiting a hotel, when you're going to bars, churches, and so on. Therefore, this new normal has also cut some diseases that are allowed by maybe eating and things that are not clean. And when you go to market, you see how they wash their fruits. And this is something that have reduced the congestion in our hospitals, because some of these small diseases like malaria used to take people to hospital. But nowadays, there's a lot of decongestion when you go to a hospital. Only this chronic disease that you find people going to hospital, because now we have also come to learn some lifestyle skills through this period of COVID-19. When we were at home, people have learned how to lose weight. People have learned how to behave and to eat quite healthy and to balance their diet. Therefore, there are a lot of things that have come with COVID-19. Also, on the issue of restriction, people now have come to learn new things. Now you don't see people crowded in one place. And these days, when you try to go in and try to talk to a person so close to them, they'll tell you to maintain a distance. And that is good, because there are some airborne diseases like tuberculosis that spread through those kind of ways. And we attribute all this to the pandemic of COVID-19, because anything that comes, they still bring some positiveness, although in a small way. But that is some of things that I've seen coming to play. On the issue of our schools, we have also seen people now adapting and going the technological way. We have seen even schools that didn't adapt the online learning now adapting that, and it's quite significant, because kids now can be able to do the assignment at work, something that is still used in Kenya today. Even after the schools have been reopened, some schools still have that online platform, e-learning that is still ongoing, and it's something that has come in even in the remote areas. We have seen schools now having a portal where you can go and your children can read, access revision materials. Therefore, there are a lot of things that have come through this COVID-19. In Kenya, we have seen young people inventing the ventilators and ICU beds through this period. And some of these people, they didn't do that before COVID-19. But because of the necessity, and as we say, necessity is the mother of inventions, we have seen a lot of things being invented in this period. Therefore, it's something that we should continue with the spirit of invention even after COVID-19 is gone. But I see in future that the government in Africa have learned a lesson. It's better we make our health system good. We better keep prepared all the time. and even into our education sector. And the young people also have raised it up, and they were in front line in championing in the social media, championing for the observation of these protocols. Therefore, you have seen also the effectiveness of the using social media. It can be used in a positive way to impact lives. These are some of the lessons that we have come to learn through the period that we have been in our homes. And also, it's a new normal these days. When you talk to a person, they tell you, now I'm working from home, the digitalization, the Zoom meetings, and so on. Therefore, there are a lot of things that have happened that were not normal before COVID-19. And I think now with the old ways and the new ways, when we combine them, now we can have an effective community where we can all live together and work together to ensure that all of us are safe, regardless of where we are. Because in Africa, we are all one. It is only these imaginary boundaries that separate us and make us think that we are different. Thank you.
Thank you so much. There's something very profound there that you've mentioned, that maybe through this COVID-19 pandemic, a lot of governments in Africa will try to fix their poor health systems. And in a place like Uganda, Vice President Constantino Chiwenga, who in August was also named Zimbabwe's health minister, said earlier this year, that was in January, that the government was planning to ban medical trips abroad for Zimbabweans, saying the overseas referrals were draining the country's coffers. And we've seen not just in Zimbabwe, but a lot of our leaders, especially in the continent, when they are seeking for the medical attention, a lot of times they fly out of our countries. They'll go to Europe, they'll go to other parts in the world because of the poor condition of the health systems in this country. So I think that could be the biggest lesson our leaders would see, and see that it's important for them to fix the healthcare system in the continent. Motion Mutembai has been with us, and I was not really aware. Motion, good afternoon. It's afternoon here in Kenya, a few minutes to 1 p.m.
Good afternoon, Miriam. It's also 12 minutes to noon, so we are almost in the noon.
Okay, very well. Thank you so much. So this conversation we've been having, I don't know what you make of this, some of the lessons, some of the challenges, and most importantly, these measures that has been put in place, because as we speak on the 2nd of January, the government in Zimbabwe introduced a 30-day curfew along similar lines as of those the government introduced last year in July in an effort to curb rising infection numbers. And we do understand this is very important so that people are able to be protected. But on the flip side, lives get affected, livelihoods get affected. So how do you think people have been impacted there in Zimbabwe, and how can we make best of this situation as it is right now?
Thank you very much. Quite an intriguing question. But I appreciate, indeed, we are in a situation where the impact of COVID-19 has to be mitigated when it comes to hunger in citizens, particularly families. What the government has done essentially is to ensure that the numbers for COVID-19 victims are kept as low as possible. But I still think the government needs to consider the aspect of the people's welfare, which as much as the Minister of Finance has been giving out certain amounts, I think about $300 or so of late, I trust it's not enough for people to survive on. The gesture is okay. The amount needs to be increased a bit so that people can sustain from it. But essentially, what we are as Africa at large is that we need to create some economic reservoirs where, under such circumstances, we are cushioned. I hear one of the speakers talking about having healthy facilities that are functioning properly. And I think that's one way we need to go, so that under such circumstances, we are not worse off. We are prepared to cushion ourselves. I can also talk about economic reservoirs of such scenarios where the government should be able to make payouts to employees payouts to unemployed citizens to ensure that they don't suffer from the impact of unexpected diseases like the COVID-19 situation. But Miriam, I am really attracted to the input that was made by Dr. Matanga in support to Ambassador Maina, where we are talking of not seeing Africa playing a critical role on the mitigation of the impact of COVID-19. And I'm saying, why should we always wait for World Health Organization? Why don't we have the AU have its own health organization, and under such circumstances, they could have been the recipients of the vaccine and test it to see its compatibility with the African blood, with the African skin, with the African origin. Because I would tell you, a vaccine that has to be introduced in someone's body considers issues to do with the DNA and above. And we don't have such setup. And I understand our governments may not have such setup. I only realized on Sunday, I think if you check for those in Zimbabwe, or if you go on the internet, I realized the Zimbabwean Sunday Mail newspaper advertising for researchers on the COVID-19 impact. But I think we need to do more, Miriam, and the panel, in terms of ensuring that whatever that we introduce to the bodies of our African citizens has been tested of its compatibility to be used by Africans themselves. In the interim, I think that is my submission, Miriam.
Thank you so
given
much.
a chance, maybe I'll add more as time progresses. Thank you.
We're actually coming to the end of the show, Motion Mtembai, but thank you so much for those points there that you've raised that are quite important. Saxon, moving forward, how has this, the measures that have been put in place on the virus itself, how has it impacted people, and how can we find a way to get around some of these restrictions that have been put in place and see that we are able to keep moving with our lives?
Many people have been affected. Like I said, most of our people are informally employed. But I think going forward, Africa should have its own research centers because we know diseases will come. We don't need to entirely depend upon aid. Just recently, I've been following, just checking the CGTN news. They're saying China has donated vaccines to 13 nations. But I'm saying, what are we doing as Africans for ourselves? I think we need to fund our research as far as health is concerned, so that at least we are about 1.2 billion people, 53 nations. Not a single nation is embarked on research towards vaccine. We've got a nation like Iran, which has been reading under sanctions. It has got its own vaccine. Why can't Africa come on with its own vaccine, which is ideal for its environment? For instance, how many nations can afford to maintain the Pfizer vaccine, which needs minus 78 degrees? Africa needs to wake up, have its own solutions. Thank you.
Very well said. Thank you so much. Abigail.
Thank you so very much. I wanted to pose something also to you and probably to the panelists as they also conclude, to say, do you have such a scenario also right in your communities, like what I've observed here? I'm talking about the issue of where we are able to be on the same page of understanding the issues at hand, to have the right package of advocates that the issue of COVID-19, the issue of following up and to the set standards and the systems shouldn't be mainly a regulatory issue, but rather it has to be a culture. We have this scenario in communities. I'll give you an example of a family where people actually exchange these masks for the sake of going, probably who is next to go to the supermarket, I give my brother, the one who is going also you share, and we see such scenarios even in public places to say, oh, can you give me your mask? Because I may meet the police, the law enforcement agency. We need a situation where we begin to grow this issue from a regulatory perspective to an issue where it is a culture of understanding why we are doing it. The communities has to adopt it so that we don't necessarily proceed this issue as an issue of the law, an issue of regulation. And going forward also, that's a challenge that I've noted. Now going forward, I think this scenario, some people may call it, yes, we want to congratulate our leaders. We have done so much because of these lower numbers that we have. But I also want to be a bit religious and say, God saved Africa, and God is still saving Africa. Because should you want to talk about the health standards, Africa is way back compared to these other nations. God is saving Africa. And of course, that does not mean that we should not do what we are supposed to be doing. We have been it's an awakening call. Now we need to focus on our indigenous knowledge systems. It's quite pathetic to realize that we now want at this point in time to begin to run around, go back to our indigenous knowledge systems. Where is research? Why are we so much investing in education so that at the end of the day we want to blame vaccines from other continents, yet we claim we boost so much of being educated as Africans? I think here we have been exposed a little bit. We need to refocus. Research must lead us. Research must inform us back to our indigenous knowledge systems, improvise from that so that we also have our own remedies that suits Africa. Here they are today. They are telling us the conditions upon which their vaccines should be maintained. We don't even have such conditions. Back to indigenous knowledge systems. Let's begin to trust ourselves. Let's gain our confidence as Africa and move forward. Together we can.
Thank you so much. Madagascar tried that indigenous knowledge. Their president, Rajulina, there came out and he was very happy to announce that we had found a solution, but perhaps if that didn't work out too well, but at least he tried. But I understand what you're saying there, Abigail, because as we speak right now, even the vaccine that has been the countries that are receiving vaccine right now, Africa is not even in the top list of urgency that they need to bring us vaccine over here. Us we'll get it when everybody else has gotten it. So I understand what you're saying. So if you can get our own solutions here, that will be good for the continent. Mr. Maganza, your last submission.
Thank you very much. My submission here, I will try to be a bit radical, but at least I hope it will save us. You see, considering the coming in of COVID into Africa, it was important. And how? It wasn't through land borders. It was through air travel. Those who can afford air travel are the rich and famous. Now we find out that, taking for example the lockdown conditions here in Zimbabwe, let me take Zimbabwe in particular. You find out that, you see, if we make an assessment, they are a bit tough on those who do not have and lenient on those who have. We find out places like hotels, at the moment they are functional. Those people who manage to go to hotels are those who are well resourced. And the rest cannot afford to go to hotels. So meaning to say, the spreading of this COVID, as long as we make it divisional, we still are not able to fight and eradicate it. Whatever method we are going to apply, it is going to be wholesome. Not that there are certain people who are going to enjoy the privileges, and then while the other people are also disadvantaged. I think that will be totally unfair if we are to make sure that we're going to win on this war against the COVID-19. The other issue, we see, we can take for example that we have got big names who have lost their lives here in Zimbabwe. Those guys have got the resources or had the resources. They could go to all those places. So meaning to say, if stringent measures had been put which applied to everyone, we would have minimized those deaths. air travel could have been curtailed as good as they had done to land travel, so that there will be no one who would travel for a particular period, let's say for a period of 2 weeks, is what we did in level 5, which was the toughest one, that no travel, no anything, people stay at home, no movement from point A to point B. If it would have been applied again this year, because our borders were opened towards the festive period, whereby there was a large movement of people from one country to another, and we allowed that to happen. In future, our leaders should make sure that such movements, when there's a pandemic, they carry diseases. It doesn't matter. At times we have to infringe on the rights of citizens, because so that this will save those who have been free from such diseases, and then the disease won't spread again. And then lastly, my other opinion is that COVID and the lockdown as such, as it is affecting the poor, it has got its social and economic effects, particularly on the poor, not on the rich. If you look at the social effects, we find out that people are still waking up at home, spending the whole day at home, as Dr. Matanga had said that. You find out that there are continuous fights in homes because the husband will try to check, how did you cook, the way you are walking, the way you are cleaning the room, and everything of the sort. And so in the end, you find out there will be conflict, and no one will be able to solve those conflicts. Secondly, there will be hunger in the home. The wife will say that there's no food. And the husband will say that, where will I get the food? And then say, you are the happy of this home, so do something to make sure that we get food. So those mitigated measures, as one of the panelists has said, that they have got to be in place so that at least we help those disadvantaged members of society. And that has to be done now. Because, for example, here in Zimbabwe, we still have another 2 more weeks on top of the month. Just imagine the disadvantaged members of society. How are they surviving? And so, which means it affects them economically and affect them socially. So, meaning to say, we have got to have a new normal and make sure that we have got to help the disadvantaged as well.
Thank you. Thank you so much, Mr. Mankanza. You've said there, men now, others have lost their jobs at home, and what they do now is trying to see how their wives are cleaning. So this COVID has made some men to become a little bit petty there. I'm just joking. All right. Let's get let's get to the final submission there from Ambassador Maina Ghana.
Thank you to my comrade in Zimbabwe. You know, sometimes it's good to be harsh with Africans, but I have at least 3 things to say. Number 1, change is inevitable, but misery is optional. That is true. If you ask my humble opinion, I will tell you COVID-19 is the best thing can ever happen to us. I don't want you to agree with me, but let me tell you why. You see, in life, in order to operate on your full potential, you need to have challenges. There was Holocaust, there was World War I, World War II, but the war is getting better and better. You cannot tell me that 1950 was better than 2000. On anything, people who has been a tough time has decided to change their life for the best, to do the best, to make sure that this kind of thing will never happen in the future. So for me, I can't say COVID-19 is a bad thing. It's the best thing can happen to us because it's a wake-up call. It can give us ability at least to prepare our life, to prepare our future. Even many marriages when a lot of difficulties during this COVID-19 because I talk about African. Maybe we African, we don't even know how to manage our marriage. But now we understand better the time we stay home with our families. It teaches us how to be patient with our wife or the husband, to be patient with the kid, to be patient in the family, to share the little, to appreciate even the little we have. So COVID has never been bad, number 1. But number 2, in Africa, we have 3 groups of people. If there is a tsunami, one group start complaining, blaming. The other group go to Moscow to church to pray. And the third group will tell you, let us try to learn how to live under the water. Now, which group do we want to belong to? Are we going to be strong people that is, if there is any issues, any problem, any challenges, we have been able to face it with our intellect, or we are going to wait for the Westerners to come and blame us, help us? What do we want? Now, this depends to us African. I said it earlier, it's not very late that we African now, we can come together and countries to say that we can help another country, either with mask or, first aid. We can help them with food. We can help each other. We have it. I don't know, maybe we don't have the culture of helping, because even our budget in Africa, we have provision for the aids coming from the United States. In 54 countries, Dr. Masanga is witness. Every country in their yearly budget, the program that they are going to help us with this amount of money to complete our budget. We never try to say that this gap, we need to fix it as African. That's why we are always congratulate John Pombe Magufuli. Either we like it or not, he's doing his best to say that we need to make sure inside our country we decide to raise some money to make sure that we can survive. Because there will be a time that these people who are helping us, they will be tired with us, or they will give us stupid conditions. Now in Zimbabwe is happening. Those sanctions has touched our Africa, Zimbabwe, and touched African countries. You see, people are suffering. Lower class citizens are suffering, but the high class are not worried. With all the sanctions, they can go to the hospital in UK, go meet Dr. Matsanga, drink coffee with him. But some of the people in Zimbabwe cannot even afford foods. So what is the next line of action? How can we do to make sure that those kind of story cannot repeat himself? That is my humble advice. We need to come as African to make sure that we replan ourselves, we re-strategize our system. We make sure that it not happen again. Thank you, Miriam.
Thank you so much, Ambassador Maina. And also we get our final submission there from Douglas Kirimi here from Kenya. Douglas, how can we learn and make best of this situation?
Okay, Miriam. Thank you, Miriam. And also, as a people, as Africans, we need to stand with each other, especially now that we have a COVID situation in Africa. We were left on our own, and the West, especially when Mrs. Bill Gates, Melinda, gave a very bleak situation on our COVID and situation in the coming days, and it didn't come to pass. We need to come together. And on the same note, I want to condemn the chairman of AU, Cyril Ramaphosa, the president of South Africa, for being too harsh on Zimbabweans and crossing the border bridge to South Africa for Zimbabweans. That shows a man that does not care about Africans, the man that only cares about his own interest. But I should also remind him, as a man who has interest in different companies and different industries in South Africa, as a man who has shares in those companies, those companies are made profitable by Zimbabweans and other people of goodwill across Africa who work in South Africa. And also, for him to be able to do that as a president and as the chairman of AU, it is very un-African of him to do that. And he should be able to change for better, because in as much as he wants to protect his people, we all know that South Africa has the highest number of COVID-19 cases than Zimbabwe. Zimbabwe, with their challenges, with the sanctions that have been imposed by the imperialists, has been able to manage their COVID situation. We have been told here that they are testing for free. They are testing COVID-19 for free. In Kenya, if you don't have $100, you cannot be able to be tested. And this speaks volumes about Zimbabwe and their leadership. The president himself, President Emerson Mnangagwa, what they are doing there and their people and their government, that is very commendable. So we are also calling on to our country and also our economy and to our president to be able to ease the pain of having to pay $100 in our country for us to be tested for COVID-19. And also for people in Africa, if you can be able to get a better way of testing, share that technology, share that method with other African countries. And also, like Ambassador Ghana Maina asked about the mask and also other support that we can do to other African countries. If we can be able to support other African countries, we can be able to send masks to Chad. Chad can send something else to another country, and we can be able to grow our African and for Africans and for our own safety and our own health. So if we stand together, our sovereignty as a people is strong as long as we stand together with each other, as long as we support each other, and as long as we share technology, we share intelligence concerning this health emergency called COVID-19, Miriam.
Thank you so much, Douglas. I know everybody has given their final submission. It will only be right before Dr. comes in to give Motion Mtembai an opportunity, because he has only spoken once He came in a bit late into the show. So, Motion, how can we cope with this, the impact that has really befell the people of this continent from COVID-19? How best can we make out of this situation, and what are some of the lessons perhaps we can gather from this pandemic that can move us forward into the future?
Thank you, Miriam, once again. Fundamentally, let's adopt certain protocols in terms of the mitigation of the impact of COVID-19, and also try to consider certain aspects like the closure of industries and business to be dealt with in a manner that doesn't bring to a stoppage the aspect of trade and business. I think the governments in Africa should appreciate that fact. We should allow our industry to continue operating fully, but in a manner that again contains the disease. I'm talking about issues to do with enforcing and implementing measures like physical distancing, masking up, sanitizing in workplaces, and meanwhile ensuring that our people continue to go to work, and though in reduced numbers, scaled down. I noticed that the government of Zimbabwe has proposed a 30% workforce to report for duty. I think we can do that, allow progress to continue, trade to continue, but enforcing any other measures that ensures that the disease is not contracted. I am a little bit skeptical about total lockdowns and this whole thing of, like in Zimbabwe, companies closing down around 3 o'clock and curfew being enforced around 6 o'clock. I think it does more damage on our economy than anything else. I would have appreciated the scenario whereby we enforce all other measures, but ensure that our industries remain functional and with the minimum possible workforce that can be there for progress' sake, because there is also life after steaming, there is life after the vaccination, there is life after I come from the ventilator, I need to eat at home. So let governments try to balance both. My submission, Miriam. Thank you.
Thank you so much, Motion. It's about 14 minutes past 1 p.m. here in Nairobi. Doctor, shortly, close it for us.
Thank you very much, Miriam. Thank you very much, the panel. Thank you very much, all of you from morning. I want to make very few observations. Point number 1, curfew. Zimbabwe, Motion Metamai, Amai Abigai, Magaza, check on curfew. There is a need to readjust the times of curfew. Let the curfew start like 9 o'clock up to about 6 o'clock in the morning to allow some economic activities to come. Even if you send these people during the daytime, they are still going to use the same matatu, manaba to go back. They will also do no social distancing. Even at night, they will do the same. So allow them, discipline them to go. Point number 2, we have talked about mindset. We have very bad mindset. Maina, thank you for raising it. We have very bad manners. And let's accept as Africans, both sides. Maybe in Zimbabwe, the manners are not as bad as some places in East Africa. There are people who have bad mindset saying the disease does not exist. And guess what? They tell others that it doesn't exist. They go around without masks. They wear their masks as a decoration, not as a preventive measure. And I am sure there are very many in Zimbabwe, like there are in Kenya. Point number 3, our economy. Economies are shrinking. They are going down. We better rethink. African Union will be sitting this week in Addis Ababa. They better start thinking on how to change the economy. How can Africa help itself and others in changing the economy, helping other African countries? Zimbabwe does not even allow somebody to pay for COVID-19 tests. But the countries that earn a lot of money, like Uganda, Kenya, Tanzania, we are charging people colossal amounts. Miriam, and the panel here from Kenya, are we not ashamed? Are we not ashamed? What can we learn from Zimbabwe about the payment before you are tested? So if you don't have the money, you have to die. Isn't it a shame? It brings us to our healthcare sector, which we are going to talk about this morning, but because of this topic. Point number 4, social life. It's changing the social life, Miriam. Men are also washing clothes in the house because they used to leave this work for you ladies. 2, it has brought husbands who used to drink up to morning and come at 5 a.m. They are now in the house. The curfew has done the job. So if your family was breaking apart, COVID has made it come together. Point number 4, it has brought up innovation, science. Many countries are now innovating the drug. We have been losing our scientists. The Mutambara going to learn about the moon in NASA, but he cannot build one single house in Zimbabwe, even to reach near a quarter of the moon. So we are having African scientists coming out to find the vaccine. Many countries in Kenya, the trial vaccines are going to begin. In Uganda, I don't know about Zimbabwe, and I'm sure I've heard there are some scientists working on the trial medicine. Point number 8, compassionate. Are we compassionate to each other? How compassionate are we about Africa? Maina was raising very serious points. What's the use of holding too many masks when Zimbabwe has no masks? What's the use of Zimbabwe holding a lot of sanitization bottles when Kenya doesn't have? Why don't we do barter trade? I give you masks, you give me sanitizer. I give you ventilator, you take masks. Because we might not need the ventilator in Zimbabwe, but we need masks. So why don't we do barter trade? Begin thinking afresh. Point number 9, enforcement of SOPs. How many people go to the toilet and come back in Nyamachoma places to greet their friends? When I reach there, everybody gets scared. I've told you, apart from men, women. Women have very bad manners on this. We are on this panel. We don't go and wash our hands. You find most of the men, they don't wash their hands when they come out of the toilet. But this COVID has now created a must. Even when you see you are going to sit and touch the hand in our meat, we say, boss, wash. That's very good. It has taught us new knowledge. It has brought some new knowledge about cleanliness. How many people here on this panel make their beds? Very early in the morning, at least I do. Some of you just wake and say, house girl, hey, Niliwacha the bed housemaid, your house help. Make it quickly and prepare breakfast for Baba. Baba is coming out. Baba means your husband, your boyfriend. You know you are destroying family. That girl will make very good breakfast. And you a hard-working woman working in office, high flyer, you might not have a husband at all. By the time you come back, they have already moved from Kariba to Lupane. They don't want to stay. They are enjoying life. And your husband will tell you, Mom, I've found someone who is able to wash my socks. So, COVID has brought some manners. Some people are washing people's socks, taking, especially we from Uganda, we have good manners. Your wife has to take out your socks and massage, put the hot water in a tray, in a basin, to massage your legs before you even have food. But some of the ladies in Africa, they stand on you, they want even to throw you out of the door. We saw manners have come, so you don't touch me until I go and shower. Remove the cloth and put, discipline has returned. Amen. Let's give hallelujah. There's discipline in the house. Some people have very bad manners in going to the toilet as if the toilet is the end of. And these are the things that Wazungu taught us. And let's speak the truth. Wazungu taught us how to go to the toilet. If there is a toilet, there is that thing on the toilet. That is for women. Remove it before you man stand. Remove the toilet thing and put it up. Some of them just go. They don't care. When a woman comes to see the toilet, she'll get a disease. Now discipline has arrived. Before you leave the toilet, make sure that it's clean. Wash your hands. Keep a distance. Shake no hands. That's very good. It has brought discipline. I agree with the panel, therefore. There is a lot to learn between Zimbabwe and Kenya on the COVID-19 situation. Let's not wait for foreign mercenaries to give us guidelines when we can guideline ourselves. Let's not use it as a political weapon to destroy others. Lastly, the controversy about vaccine. I have a reservation, but I will not make it here so that our account is removed. But I have a reservation. You know, if you criticize COVID-19, they will take your account of Facebook. So I will not make it. Miriam, me, I had reservations about Dr. Tedros long time ago. And I warned Maina. Maina told me I should support an African because he's black. I told him, no, he's black, but he's a member of Mr. Microsoft, Bill Gates. Bill Gates hired him to go around the world to campaign for his seat. So he has to pay him back. He is from Ethiopia. He is from Tigray. He's the chairman of Tigray TPLF. I told you he was a rebel last year, Miriam, in March. Didn't I tell you he's a rebel like a Matanga? Was a leopard, remains a leopard. Is he not a rebel now? He's the commander of TPLF. He has not lost. So can you see? Was I wrong? Was I wrong, Miriam? Give me a credit where it is due. I told you last year that Mr. Tedros is a commander. He's called Commander Tedros because I know him from 1987 in London. We are all rebels, commanders. He was commanding the Ethiopian TPLF against Mariam High, the man who lives in Mengistu Maile Hadiam. He lives where Madaza is parked near there. Yeah. Tedros was fighting that man who is there now in Zimbabwe. So I know him as my brother. But he is a thief. I know him as a thief. Maina don't, you see Maina has gone off. Because he's a thief. I'm telling you the truth. He was given work to do something. He filled a form which led us to have a problem, Miriam. Up to today, whenever I think about that 150,000 Kenya shillings, pounds or British money which we lost, I'll never forgive Tedros. I want to thank you, the panel. I want to thank you, Miriam, for having been patient enough for long stories. But they have taught something. We have learned something from Zimbabwe. Let the Zimbabweans go and fight for curfew to be extended. Some of us will help through other means. Tell the Minister of Health the advantages of curfew being 7 o'clock. No, 6. These advantages are very many. People are trying to earn a living. Give them time up to 8 or 9. You can even police it up to 6 in the morning. They should not come to town, so that people are able to do some trade. Otherwise, if you do the lockdown of that curfew 6 to 6, you could create a regime change. It's very easy. So we don't want to go that side. Thank you very much, Miriam. God bless you. And I'm off the line. If there is, unless there's any question.
Oh, no. Thank
then
you
I
so
can
much.
stay.
Thank you so much. It's way past our time now, 27 minutes past 1 p.m. here in Nairobi. Thank you, all of you who participated on today's show. Thank you, Mr. Maganza. Thank you, Abigail Mufambi. Thank you, Marlene from Nairobi. Thank you, Douglas Kirimi. Thank you, Javan Karanja, Saxon Svina, Motion Mutembai, and Ambassador Maina Gan. And of course, thank you so much, Dr. Matsanga. There's something I need to read here, and perhaps you'll look at it next time on our show. The new sanctions against Zimbabwe and the United Kingdom on Monday imposed a travel ban and asset freezes on 4 Zimbabwean security chiefs for alleged gross human rights violations. And the 4 Zimbabwean officials are National Security Minister Owen Kube, Isaac Moyo, Director General of the Central Intelligence Organization, Godwin Matanga, that is the Commissioner General of the Zimbabwe Republic Police, and Anselm Sanyatwe, Commander of the Presidential Guard and Tactical Command of the National Reaction Force. British Foreign Secretary Dominic Raab said the 4 were being punished for the killing of protesters by security forces in 2018 and 2019. British Ambassador to Zimbabwe, Marlene Robinson, said the UK will continue to push President Mnangagwa's government to implement the reforms it promised over the last 3 years ago. So that is something that we shall look at. Unfortunately, we don't have time, but that is the latest there from Zimbabwe.
There is no need of looking at it.
All right. My name is Miriam.
Answer is direct.
Bye-bye.
Before you the Zimbabweans go away, Zimbabwe is a sovereign state. Zimbabwe has courts, law courts, that can try those officers. The British have no right whatsoever to tell Zimbabwe how to punish their officers. This is something I am opposing from London, and I will oppose it like I've been doing. The British will not harass me. There is no, you cannot oppose, you cannot dictate to what Zimbabwe should do to the people when they have put a commission of inquiry. There was a commission of inquiry. There was no timeline when to prosecute. I'm taking the matter up. I've taken it up already.
Okay.
Just look at my English tomorrow. I'm delivering. Look Look at the document that I'm going to release tomorrow. Don't threaten Zimbabwe. Zimbabwe has rule of law. The courts in Zimbabwe are more efficient than even some countries in Africa. I'm telling you, the prisoners are more treated in yellow uniform than some countries that have no uniform in prison. So there is no need of punishing a country. Let the Zimbabwe government take over the cases and punish. Already there is conduct on how to punish people.
All right.
This is a regime change created by a man called Alex Magesia, who is in London with Alan Musupa, with Walter Muzembe. Me, I don't keep my mind slow because I don't have a lazy brain. My brain works 24 hours. I am going to go for them head on.
All right, Doctor,
and
thank you.
I'll put them in the Foreign and the Commonwealth Office.
Yes.
Zimbabwe has courts allowed Zimbabweans to charge those guys so that those guys can be punished by Zimbabwean law. For British government to carry this case and take it somewhere, you are just worsening a situation that cannot be. All of us give our views. I am also a member of Chatham House. I speak with authority, Magasia. You came as a small refugee from Zimbabwe recently in London, challenging me, and you see the earthquake. Yeah, I've been in London for 36 years. Don't pretend to, you just came from Zimbabwe recently. Running away, you are hobnobbing with Moyo, Jonathan Moyo. You are one of those who were even detaining Zimbabweans in Zimbabwe with Jonathan Moyo. We know you. We have been here and we take no prisoners, man. We know where. You cannot bring a concocted motion that you want to go under 4 officers. Now what do you want to do with them? You want Zimbabwe to put a firing squad? There are laws in Zimbabwe. Let Zimbabwe carry its wrong activities, law and order. It has already removed some of those people from the army. One of them is an ambassador, already taken away from the command of the army. Is that not a punishment enough?
All right, Doctor, thank you so much.
What accountability? This accountability of injury justice. An eye for an eye, Hammurabi.
It's worth discussing this topic.
Yes.
All right. Thank you so much, Mr. Maganza. Thank you,
injure
Doctor.
my eye, I injure Miriam's eye. Here, when we did end, restorative justice is the best way forward.
Yes.
The Commission of Inquiry delivered the document to President Emerson Mnangagwa. He has the document. Those who want to know about the document, Google it. Google it and see there was nothing hidden. Hasn't Trump, how many people died in America? How many? They jumped on a building which has never been jumped on since 1872. Isn't it? But they jumped on it and they urinated on it. They destroyed it. Some of them were even urinating on the building. Didn't you see on live TV? Have we arrested them?
They're being arrested. Doctor, that's why I said it's a conversation. We could have this
They
next time. Because our time is really far gone. Can we? I'm exhausted. Yes.
Thank you very much.
Yes.
Later your topic. Bring it on.
Yes. That's why I said we'll find time and discuss it in depth. All right. Thank you so much, Doctor. Very passionate.
Yes.
Doctor, very passionate there. Doctor, thank you so much. Thank you. And thank you, our viewers. My name is Miriam. I really have to go. Bye-bye for now.
Thanks.
must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.